My name is Ryan. I'm a behavior specialist here at Rogers. Typical day for me, I'm gonna come in, catch up on some emails, and then kind of game plan for what the day is gonna look like. There's gonna be individual sessions, there's gonna be family meetings, I'm gonna be assisting patients directly with exposures and other treatment assignments. I'm gonna be collaborating with other treatment team members. I might work with some parents on some coaching, leading groups. It's a very action-packed day, a lot going on, super fun, very busy. When it comes to technology, I'm gonna be on my computer a fair amount, whether that's checking emails, sending emails. I might be documenting on how my sessions are going throughout the day, using Microsoft Teams to message and communicate with other members of the treatment team. The physical aspects, you are definitely on your feet throughout much of the day. You're kind of just bouncing around from patient room to patient room. You might sit down for a little bit, communicate with other members of the treatment team, but it's definitely a pretty action-packed day where you are kind of moving around in a bunch of places at once. I would say the difference between maybe a residential behavior specialist and someone who's more in the PHP, IOP realm, a lot of structure in residential, so you have the additional support of RCSs to really kind of carry out some of that treatment work for you on the nights and weekends. Whereas at the PHP, IOP level, the behavior specialist really is kind of independently responsible for that. But when it comes to just implementing the actual treatment work, very similar. I think one of the daily challenges that we face in this line of work is just patients being scared to do the work, whether that looks like opposition or a little bit of avoidance. So not necessarily working with a lot of individuals that are really ready and motivated to get after it. So you do find yourself in kind of a bit of a coaching type role where you're really trying to meet them in the middle and try to find ways to be really creative in helping them. So although even though most patients are pretty hesitant at first and maybe on the fence with doing some of the treatment, it's really rewarding as you're able to kind of build that rapport and get to know them over time to kind of see some of those defenses fall and get to a place where they're a little bit more confident and able to do the work and being able to see the results and them really grow with the work that they're doing.
Here we have the CBT triangle at the top point.
At the end of the day, I work at Rogers because of the patient care. It's really simple. They get better. I'm a huge advocate of cognitive behavioral therapy. All types of clients, population, if they're willing to do the work, you're gonna see amazing things happen. And it's such a fun, cool, rewarding thing to be a part of, to see someone kind of get their life back because of the treatment that we're providing.